Thus, let's now take a look at matters health. The Ministry of Health has this morning released the first ever confidential inquiry into maternal deaths in Kenya and guidelines and responses put in place to address gaps that have been identified. Now, the report examines the case files of mothers who died in hospital in the year 2014. Key among the findings is that half, which is 50% of all maternal deaths, were among women who had been referred from another facility, mostly from level 4 to level 5 or 6 health facilities.
So that we can have a consolidated reporting mechanism. And I think that, ladies and gentlemen, it is the way to go, because we are all here for Kenyans, we are all here to serve the Kenyans, and we need to report and share information as it comes. Again, the issue of referrals, effective referrals, and I'm glad that Dr. Obara has mentioned about what they are doing in the county. We want to come and learn from you, the best practices. What is it that we are doing, especially on effective referrals? We want referrals that are effective in that they are timely and they are able to save lives, they are able to be related with better health outcomes. These are things that we need to really to be looking. And then the issue of supervision. I think this is another area where you cannot be talking about quality of care if supervision is not there. Supervision in all our facilities, even at the community level, we need to understand what is really happening. Are the people reporting on duty? Get to hear from the patients exactly what is happening and all those things. And I'm sure that we'll be having a health sector that is responsive to the needs of the Kenyan. And therefore, ladies and gentlemen, it is now my pleasant duty and honor to officially launch the confidential inquiry maternal death report, the National Family Planning Costed Implementation Plan 2017-2020, and other reproductive health documents, and the Division of Family Health.
All right, and from that particular report that was released today on maternal deaths in Kenya, most of it in the year 2014, let's now take a look at some of the specifics of that particular study and the specifics of the findings that have been made before we have that conversation with Dr. Gondi. So from that particular report, it says that only 5 in 10 mothers had antenatal care. That means only 50% of the mothers in 2014 had their antenatal care while they were expectant. We also have 5 out of 10 were interpartum and postpartum deaths, which once again is half the number. Some of the specifics from that particular report that was released today by the Ministry of Health. And of course, we're going to get more answers from Dr. Gondi. Let's take a look at another of the findings. It says that 3 out of 10 mothers who died had stillbirth. 3 out of 10 mothers who died had stillbirths. One of the major findings from that particular report. Remember, the report also says that most of these deaths occurred out of office hours, according to this particular study, and things like excessive bleeding being attributed to most of the lives that were lost among mothers who are expectant. Let's take a look at another of the findings. It said that substandard care was identified in 9 out of 10 maternal deaths. Of course, this is a red flag. One of the major questions I will be posing to the doctor. 9 out of 10 of the care or of the deaths were as a result of substandard care in various hospitals in the country. This is something that continues to worry most Kenyans as far as maternal health is concerned. The report also says that delay in starting treatment, 33%, inadequate clinical skills were 28%, and of course, delay in starting treatment, 33% of it is blamed on delay of starting treatment, delay in monitoring attributed to 27% of it, and were not the most frequently identified by health workers or the health workforce related factors from that particular report. And finally, let's take a look at the last one. It says that 91% of women who died of obstetric hemorrhage received suboptimal care, and where there were different, let's just take a look at the other board and see this particular report and what it said, where they say that there were different, where the management would have resulted in a different outcome. This is some of the highlights of that particular report that was released today. I want to now cross over to the other side to have that conversation with Dr. Joel Gondi is the head of Reproductive and Maternal Health Services at the Ministry of Health. Once again, thank you very much for joining us here on KTN News. Dr. Gondi, once again, asante sana for joining us here. This report is one of a kind because not very many times you see the ministry go within to just see what kind of problems are there and why our state of health is the way it is.
Thank you very much. Okay, so I think I want to start by saying that today the ministry has launched about 10 reproductive health documents, policy documents that should be able to guide the country towards realizing more women being healthier and more women receiving care, quality care when they need it. Focusing on the one that we are talking about, the Saving Mothers' Lives Confidential Inquiry, you know that the government has really put the maternal and child health at the center of health in Kenya. In 2015, the president signed the SDGs, which was committing that as a country, we are going to do everything we can to reduce maternal deaths to up to 150 per 100,000 live births by 2030. We are going to ensure that we put right investments in the factors that really make women have negative outcomes during pregnancy. And with that, when back to Kenya now, we have had several initiatives which have really led to increased investment in reproductive health. And you are aware of the initiatives like we started with the free maternity health services, which was giving almost about 4 billion Kenya shillings to support health services at the health facility level, where the services are needed most. We also had other, right now it has transformed into the Linda Mama package, that now they get it through the NHIF. But also the First Lady also had this initiative where we had the Beyond Zero, where a lot of investment and advocacy went around no woman should be dying giving life. So with all these initiatives, and with that call, the country developed a framework for investment in reproductive health, which we call the Global Financing Facility. And this one kind of streamlines and harmonizes investment in this. So a lot of resources has gone towards now making sure that the mothers are kept alive and have quality of life. So part of this process now comes to why now we're doing this study. As we do all this, the numbers have increased. Right now, we're talking about 1.2 million women delivering in our facilities from 400 when we started. So that's a huge rise. And of course, with that rise now, our next priority, our next frontier is, besides just the numbers, can we look into the quality of service, the quality of care that they are doing? So it's one of the strategies that we employ. And therefore, besides, before we get up to this report, we have a national committee that was formed by the Cabinet Secretary for Health that advises from various sectors on one, how to ensure that the maternal agenda stays focused. Two, looking at the legislative and policy environment to see what needs to be done differently so that we continue improving. And three, doing periodically now inquiries into the death, because we know women die, and according to our estimates, about 8,000, with our population, about 8,000, we lose about 6,000, 8,000 mothers in the country. But with about 62% of women accessing care in our facilities, then that proportion, we are talking about 4,000, 5,000 women still dying in our facilities.
But I like that you mentioned the issue of quality, and this has been a concern among very many Kenyans, the quality of healthcare in this country. From some of the highlights of that particular report, we see that 9 out of 10 of the deaths were because of substandard care from the various health facilities in the country. This should also be a starting point, no?
That is a major, one of the reasons why we do this study in the first place. I also want to remind at this point that this study was not contracted by anybody else. It was an internal study done by the ministry and the partners to look at what are still the issues that need to be addressed. So if it's just a report that leads to no action, then it is not a report. We want the report that the main reason why it should come out is we share it with the actors, the facilities, the community, the health managers. And today we are having county governments. We had the CCs and the directors and the reproductive health coordinators. And we had the partners who are investing with together. So the question we are asking, with this now, then so what? How do we move forward as a country with the purpose of, again, we'll be continuing to do this. As we continue investing, we check again also to ensure that we are in the road to ensuring that no mother dies.
I mean, from this particular report, as the head of reproductive and maternal health in the ministry, and from the statistics that you've gotten from this particular study, what are some of the top priority things we're going to see the ministry work on after these findings and the statistics?
Thank you. The actions that we are having or we are employing they are in three prongs. The first prong is the leadership bit of it. We are saying that we are going to continue aggressively offer leadership about maternal deaths and accountability mechanisms. So here we are talking about, we are not going to shy away from not sharing. We are going to continue looking at what is causing the deaths and addressing them at all levels.
Do you think currently leadership and accountability is lacking?
It is very much right there. When I'm talking about the leadership, I'm talking about we're talking advocacy, because we need constant reminder. Remember, the First Lady keeps on talking about the maternal and child health, So this is going to continue. We want to scale this up down to the counties, so that at the county level also, we have champions from the First Ladies and other opinion leaders who should be saying that this is unacceptable. Every death is investigated, audited, and action taken to prevent another woman dying from a similar preventable cause. So it's a cycle. Information is released, information is gotten, we look at what led to the problem or what led to the challenges, and action plan is put in place to prevent a future one. Yes, so that is at the leadership level. We are looking at the issues of the investments. As I've told you, there are resources that have really come in the reproductive space in the last few years. We are talking with the COG and the county leadership to ensure that the resources that are needed, whether it is human, whether it is financial, is available for reproductive health services. And right now, we're looking at innovative ways of even accessing these resources. We are saying that for facilities to assess the resources, some of the benchmarks that will be used is quality of care. So that if your quality of care, we are going to have an accreditation system, so that a facility, after registration, there is assessment. And then if you are certified, whether you are going to be 1-star, 2-star, 3-star, so that the people can know. They know that I'm going to have this facility, it is only 2 stars. Probably, if I have a choice, there's a 3-star around. And therefore, this will also inherently improve competition towards improving quality of services in our health facilities. Besides that, we are looking at the legislative area. Right now, we know the health law has come out, and it has ensured that now the issues of the regulation is very strict, and all the regulatory bodies, the medical board, the poisons board, the nursing council, and the clinical officers, we have shared this report with them. And right now the approach is, when we're going out to oversee facilities, we go as a team. So that way, when the laboratory is saying there's a problem with the laboratory, then there's a problem with the clinical officers, there's something that now we do a work plan together. The third issue in that area of legislative area is we are going to look at, we are developing as a ministry the maternal neonatal health bill. We have a bill right now, which we want to do 3 things. One, to ring-fence resources for reproductive maternal health services at all levels, so that we know from the word go that we know this proportion of resources is going to be available for the mother, for the child, in the facilities and in the communities. The second one is going to put a framework for accountability, especially the social accountability. We want to ensure that every death of a mother is accounted for, and reports is written, and the community gets feedback. And this is what caused the death was avoidable, or the death was not avoidable, because some deaths definitely will be avoidable. But we are saying the avoidable ones are then corrective action. This way, even governments, responsible people, doctors, healthcare workers, they will be knowing that you have to be accountable for your time. You will be accountable for the resources that is given unto you towards improving maternal health. And at the country level, we are, as I said earlier, we're also looking, some countries are already ahead. Kakamega County has already enacted that bill that I'm talking about here. So the resources now, we want to see how that plays out. We are guiding countries to ensure that that law, that bill is worked and it comes into law, so that they also have that. And have champions that work on that. But most importantly, community participation and the voice of the users. We want the mothers, we want the families, we want the leadership, people to ask the right questions. Why is this happening in our area? Why is it not happening in the other area? So that the solutions come from within, but all of them aimed towards improving the life of mother in the country. Yes.
But quickly, I would want to let you go in a minute. As you talk about social accountability, we'd also want to know what are the plans for financial accountability. The Ministry of Health is one that has also been dogged by corruption scandals, and it's a trickle-down effect. If the funds are misused, then all these services you're talking about giving mothers and children out there will be in vain.
I agree with you, accountability has to be at all levels. And I believe with the new government, I believe structures are already put in place. And the president is very particular about this, about individual responsibility. So I believe now it is the time that people walk the talk. Yes.
Thank you very much for speaking to us here on KTN News Desk. Dr. Joel Gonde is the head of reproductive and maternal health services at the Ministry of Health, as we take a look at that report and the findings on maternal deaths in the country. Once again, thank you very much.